Hello, this is Mike with SIMA Pro, and today's video we're going to talk about Medicare 101, the basics of Medicare. Now, this video is designed for insurance agents. It's from the notes and tips from field agents. So these are not only the basics of Medicare, but some hints and tricks from agents who have sold policies in the field, myself and other agents included. Now, it's an overview of Medicare A and B. We do have additional videos about Medicare supplements, Medicare and C&D plans available on SIMA Pro as well. But again, this is more of a high-level overview for agents who are either new to insurance or new to the Medicare market. Now, CMS, or the Centers for Medicare and Medicaid Services, is a governing body over Medicare. They set the rules and guidelines for not only the insurance carriers, but also for the providers, hospitals, doctors, specialists who accept Medicare. Now, it's important to know that Medicare or CMS works hand in hand with Social Security. Social Security pretty much is the data source for CMS. So when CMS or Medicare has to find out who's turning 65, what their address is, how much you're paying for Part B premium to get their income levels and such, etc., they will contact Social Security to get that information. And just so you know, CMS is pretty much the background for Medicare. So Medicare is more consumer side and CMS is more agent and provider side. Now, Medicare is broken down into four parts. Part A, which is hospitalization, Part B, which is medical, Part C, which is Medicare Advantage, and Part D, which is prescription drug coverage. Now, as you can see to the right, Part A and Part B can constitute original Medicare because this is what comes on their Medicare card. And Part C and D plans are optional coverage. They are not required to have either plan. Now, it is true if they delay their Part D drug enrollment and don't have credible coverage, they can be penalized for waiting. But again, it's not required for them to have. And obviously, as I mentioned before, in this video, we're going to talk about Part A and Part B. When someone's aging into Medicare or first getting Medicare, that pretty much happens two ways. The vast majority of people you talk to that are getting Medicare for the first time will be aging in or turning 65. Usually about 3 months out, they'll get their red, white, and blue Medicare card in the mail with enrollment into Medicare A and B. Now notice I said the red, white, and blue Medicare card. Whenever you ask to see someone's Medicare card, always ask to see their red, white, and blue card because then they'll know exactly what you're asking for. If you ask for just their Medicare card, they may pull out their Medicare supplement card, their Advantage card. I've seen people pull out membership cards thinking it was their Medicare card. Just tell them no, it's a red, white, and blue Medicare card. Plus, it puts an image of their head of, okay, I need the red, white, and blue one. Sometimes it takes away some hesitation to show it to you because you know exactly what you're talking about. The second way people can get Medicare is through disability. If they've been disabled for 24 consecutive months, they could actually apply for Medicare. If you run across someone in the field and they tell you they've been disabled for 24 months or a couple years and they don't have Medicare, send them to Social Security. This is where they apply for disability and Medicare. There's not a lot you can do beyond that point because of HIPAA rules and regulations. So send them to Social Security and then maybe follow up with them in a couple weeks or in a week to see what they're doing and let them take care of it. Again, there's nothing you could do. I've had people ask me for assistance. And again, with HIPAA rules and regulations, there's not a lot you can do for them. So when they get their card in the mail, this is how it will come. It'll come on a larger sheet of paper, smaller than an 8x11, but larger than a typical card. The Medicare card itself is the average size of a credit card. The front will have this information, as you can see to the left. The back is important to know because they could opt out of Medicare Part B, which we'll talk about here later in the video. Now, this will come in a plain brown envelope with a Welcome to Medicare booklet, a little publication going over the very basics of Medicare. If for some reason you're talking to someone that's aging into Medicare within 3 months, 2 months, a month, and they haven't received their Medicare card, it could be usually one of two reasons. The first reason is they're not drawing Social Security. If you're not drawing Social Security, they may have to call Medicare on their own to start the process because they weren't flagged in the system as turning 65 because they're looking at who's drawing Social Security, and if they're not, they may fall through the cracks. Or they threw it out. I've had people that have gotten this in the mail, thought it was junk mail, and just threw it out because they don't know who CMS is. Again, it's a more of a plain basic envelope. We get so much junk mail nowadays, they've thrown it out. If that happens, all they have to do is, in either situation, is call Social Security and get it taken care of. Now, their Medicare card itself, there's a couple key things to point out here to make sure all the application information matches their Medicare card. As you can see, there's three main areas to pay attention to. The first is their name. In this case, we have Jane Doe. Well, let's say Jane went by Mary her whole life. But you don't want to put Mary Doe on the application because it doesn't match Medicare's records. So when they submit the application for approval, they're going to see Mary Doe on the application, Jane Doe in the system, and it can throw up a red flag and delay the process. The second is a Medicare claim number. Medicare claim number is a lot of times there's social security number with an A at the end. However, if they didn't qualify for benefits, which we'll talk about here shortly, it may be someone else's social security number with a different letter at the end. Or depending how they're getting social security, they may have letters in the beginning. So however sits on their Medicare card, write it down on the application. And the third thing to pay attention to are the enrollment dates. As you can see, Jane got her Medicare on 7/1/86 for both A and B. Now, we spoke very briefly in delaying the Part B enrollment, which again we'll talk about here shortly. So let's say she waited 2 years to start Part B. So those dates could be 7/1/86 and 7/1/88. Make sure those dates match the application. Now, it's also important to note that Medicare does everything on the 1st. So anything she does, if she enrolled in August, it'd be August, or it could be August 1st, September 1st, December 1st, but it's always on the 1st of the month. So you see a month, the first day, and the year. Now we'll go over the basics of Medicare Part A. And Medicare Part A is the four main parts are inpatient hospitalization, skilled nursing care, home health care, and hospice. So inpatient hospitalization has a deductible of $1,216. This will cover them from days 1 through 60 in the hospital. So that one deductible, they're covered for all 60 days. If they stay past 60 days, it will be $304 per day, days 61 through 90. And then if they stay past 90 days, days 91 to 150 are their reserve days, and it's $608 per day. It's important to note that the reserve days can only be used once in a lifetime. So if they use them once, they no longer have those again. And after day 150, Medicare no longer has coverage in the hospital. Now, the benefit periods will reset after 60 days of no utilization. So what that means is if, let's say, Mary went to the hospital in January for heart trouble and she paid her $1,216, and then she went again in June, because there's been a 60-day break in care, she's going to have to pay the deductible all over again. If she goes 2 weeks later for the same thing, she's still covered on the same benefit period. Now, most people stay in the hospital on an average of 4 days, so I haven't seen any of my clients have to use a per-day occurrence, but it's just important to know. Now, if they need therapy between hospital and home, they could get skilled nursing rehab. This is typically performed at a wing of a local nursing home, and the first 20 days they're there is $0 per day. So they owe nothing for the first 20 days. After the first 20 days, it's $152 per day, days 21 through 100. After day 100, they're considered a resident of the nursing home, and Medicare does not cover residential care. Again, same with the inpatient hospitalization. The benefit period resets after 60 days of no utilization. So let's say Mary goes to the hospital, gets a new hip. It's also important to note that they need a 3-day hospital stay to qualify for skilled nursing, and most nursing facilities know this. They'll work with the hospital on that. So she stays in the hospital for 4 nights, gets her new hip, goes to a skilled nursing center, and she's there for 14 days, and she goes home. But she's still having a lot of trouble. She goes back a week later. She only spent 14 days there, has been a 60-day break, so now she's on day 15. If she goes back 6 months later, she's got to go through the process all over again of having 3 nights in the hospital, and then she'll start day 1 again. So again, you won't see this too much in the field. It's just important to know that a 60-day reset, they need that to reset the benefits, and most nursing centers will work with your patients on this. Now, home health and hospice care, there are no copays because Medicare covers both 100%, and it must be doctor ordered. So they can't just wake up one morning and say, I wish I had home health care, I'm going to order it. No, a doctor has to order either or, but Medicare will pick up all the costs. Now, Part A has no monthly premium. To qualify, they must have worked 40 quarters or 10 years or draw off someone who has. Remember, we looked at that Medicare card and I said it could be someone else's social security number? This is the case. Let's say you had someone that only worked 5 years because they were home raising the children, but their spouse has worked their whole life, past 10 years. They could draw benefits off their spouse and get Medicare off of them. So in that case, it would be their spouse's social security number with a letter at the end. Same thing with children. If you have a disabled child that needs that's going to jump on Medicare, they can jump on through their parents' benefits. Medicare Part B is medical coverage, and this covers doctor visits, outpatient procedures, even if the outpatient procedure is at a hospital, as long as it's an outpatient procedure, be covered by Part B. Durable medical equipment, wheelchairs, walkers, oxygen, etc. Tests, labs, x-rays, all this is covered under Medicare Part B. Now, Medicare Part B has an annual deductible of $147. After that deductible is met, Medicare for most services is 80-20, 80% for Medicare and 20% for the beneficiary. Now, it is important to note that some mental health services are not 80-20. It's a little more skewed, but for most medical procedures, it's 80-20. Now, Medicare Part B has a premium. It's $104.90 and may be higher depending on their income, which we'll talk about here shortly. It will auto-draft out of their Social Security check. So if they're drawing Social Security, Medicare will automatically take it out. They don't have to do anything. It automatically starts coming out when they turn 65. If they're not drawing Social Security, they will be billed quarterly for the $104.90 or higher depending on their income. As you can see on this 2014 Medicare cost, this is a CMS approved piece you can download off SIMA or off Medicare.gov. If you go to Medicare.gov, the far right tab, go down to publications and type in 11579 in the search, this will pop up. Or you can search by Medicare costs or whatever search criteria you choose to use. This is a two-sided piece of paper. This is the front page. It has all the deductibles and costs we talked about, including the Medicare Part B costs for their premium. As you can see, $104.90 is for most of your clients, but for your higher income individuals, it'll go all the way up to $335 depending on their tax return. And then the second side has Medicare Part D information. Same thing with Part D. The more they make, they may have additional premium on top of their plan, and it's covered on the backside of this form. Now, we talked about delaying Medicare Part B. This is why. If someone's turning 65 and they're covered by group or still working, and the coverage is considered credible by Medicare, they may not need Part B. So they could avoid paying that $104.90 per month on top of their current medical coverage if they have credible coverage through their employer or group. Now, have them call the benefits administrator to verify they don't need it. So basically, if they're working and their employer group has more than 20 people, have them call a benefits administrator and say, do I need Medicare Part B? They may say no, and then whenever they retire or come off group coverage, they can call the benefits administrator, get a copy of that letter saying they've had credible coverage, go down to Social Security and enact Part B at that time. So this is very common. They do have, after they get Part B, they have some enrollment periods. Typically, what I've seen in the field is if someone's on group coverage at 65, and let's say they want to work for 2 more years for whatever reason. So when they turn 67, they could go ahead and get Part B enacted, get that going. They'll pick a Medicare plan. So whenever their group plan ends, their additional insurance will kick in, Medicare and whatever other plan they pick. So most people that want to have no gap in coverage can do this. They can do it after they drop their group, but again, most people want that seamless transition from group to Medicare coverage plus a supplement or advantage or a Part D plan. They want everything to go seamlessly. That's typically what you'll find is someone that's 67 and, hey, I'm retiring in 2 months, what do I do? And then you can just tell them to go on Social Security and get the process started. Now, Medicare may not cover everything, and they don't. So here are some things that Medicare won't cover. They won't cover long-term care, assisted living, or nursing home. Remember, we talked about the skilled nursing rehab. It's only good for 100 days because after 100 days, they consider you a resident. And Medicare does not cover residential care. Most dental care, eye exams related to glasses, dentures, cosmetic surgery. So if Mary wants that tummy tuck, she cannot get it through Medicare. Acupuncture, hearing aids, routine foot care, etc. These are a lot of the same things that traditional insurance won't cover anyway. Medicare follows the same thing. Now, enrollment to other lines of coverage when someone's first getting Medicare. For Medicare supplements, they have 6 months after the Part B effective date. So if their Part B effective date was July 1st of 2014, they have until December 31st or 6 months to pick a Medicare supplement underwriting free or guaranteed issue. Now, if you want a Medicare Part C or D plan, they have 3 months prior to the 65th birthday month, the month of their 65th birthday, and 3 months after. It's important to note that they will get Medicare on the first day of their birthday month when they're turning 65. So my birthday is on May 25th. When I age into Medicare, my Medicare agent date will be May 1st. The only exception is if their birthday is on the 1st of the month, it will start 1 month earlier. So if my birthday was on May 1st, it will actually start April 1st for me in that case. It'll start 1 month earlier because my birthday is on the 1st. So now for Medicare supplements, we have additional training on that on SIMA, but just so you know, they can enroll before Medicare starts. It'll just be delayed enrollment, typically 1 to 2 months out. Some additional notes about Medicare. Medicare has no max out of pocket. This is why a lot of people see these deductibles, see these co-insurances. There is no max out of pocket. They will keep paying as long as they keep utilizing Medicare. They want some protection. So selling a Medicare supplement or Medicare Advantage plan is almost built in because most people realize I need something other than Medicare to help offset these costs. It does not cover international travel. Some Medicare supplements do. But if they just have traditional Medicare, it stops at the borders. Also, the following note is on Medicare.gov all over the place. It talks about that your healthcare provider may recommend services more often than Medicare covers, or that Medicare doesn't cover, and they're on their own for paying. So this is a great tool to use to show your clients. Go to Medicare.gov, take a screenshot, download a page that this is on, and say, hey, there are things that Medicare won't cover. It's a great cross-selling opportunity for you, depending on their need. So quick thing about Medicaid. A lot of people get confused about Medicare and Medicaid. Medicaid is state assistance for low-income seniors. It's also for children and low-income individuals. But since we're focusing on the senior market, if they're low income, they can get Medicaid as well. Different states have different criteria for Medicaid coverage, qualifications, and enrollment. So one state may say you need X amount, you can have no more than $1,000 in your bank account. Another state can say you can have no more than $2,000. Each state is different on their criteria. Now, dual eligible is having both Medicare and Medicaid. Medicare will always be primary, Medicaid will be secondary. But once they get Medicaid, they will have to go to Medicaid providers. Not all Medicare providers accept Medicaid. So if they fall into Medicaid and their doctor does not bill Medicaid, their doctor no longer has to see them. They have to go through the Medicaid network. So again, if you have more questions about your state Medicaid, call your upline, call your carrier, and ask them because, again, all 50 states have their own rules and regulations for Medicaid. So it's important to find out how it works in your state if you're working with dual eligibles. So thank you. Hopefully you got some basic information. There are additional resources on this page to download or on SIMA if you're watching this on YouTube. But go to SIMA Pro. There are, again, additional resources to help you succeed and also additional training videos about other lines of Medicare. So again, my name is Mike and visit us at SIMA-net.com.